Bronchial asthma is a disorder of the breathing tubes. It is very widely prevalent throughout the world. In fact, in the world, there are about 300 million cases of bronchial asthma today. However, bronchial asthma affects more in children. And a large number of children, though they overcome it, it becomes a permanent feature in a number of children. And therefore, it also is a major clinical issue and problem in children. Bronchial asthma is mainly a heterogeneous disorder. That means each individual's asthma is different. The etiological factors are different. The trigger factors are different. But we must remember that bronchial asthma is a hereditary condition. It can come into families, and if one of the parents has bronchial asthma, it is likely that the child would suffer from the symptoms of bronchial asthma. As I said, bronchial asthma has various factors, etiological factors and trigger factors. Now, trigger factors are the ones which worsen the bronchial asthma existent in a person. Now, these trigger factors are very common and they exist almost everywhere in the environment. For example, a house dust mite, this microscopic dust collected in the corners of the rooms, is a very important trigger factors. Cockroaches droppings, the pets, the skin peelings of the pets are called as danders, are responsible for triggers. Emotional factors could trigger bronchial asthma. Certain food items could trigger bronchial asthma in certain individuals. So, one has to be extremely careful. If he has bronchial asthma, he should try to identify the triggers so that his symptoms are prevented and his asthma remains under control. Well, as I said, asthma is a heterogeneous disorder. Each person's asthma is different. Their triggers are different. Their response to treatment is different. Therefore, one has to thoroughly investigate a patient before prescribe him the treatment as to what type of asthma he has got. For example, if he has allergic asthma, he has got irritant asthma, etc., and offer the treatment accordingly. But by and large, most of the patients with bronchial asthma, they respond to standard treatment very well. Well, bronchial asthma is a disorder. We don't call it a disease. It is inherited, and therefore a person's breathing tubes are weak, and therefore it's very difficult to get rid of it. So, in short, asthma is not a curable condition, but it can very well be kept under control. And if we do that, over the years, the severity, the symptoms, and the patient's suffering decrease gradually. Therefore, what's important? Identify your patient that he has asthma, find out how severe it is, and prescribe him the right treatment to get a better response and bring him out of his suffering.